Hi, welcome to Renew Education, and we are looking at another case study here. This one is, I would just call it poor ridge number 3. So what do I mean by poor ridge number 3? This is very typical, people losing their first upper right molars. And this is very typical of what you see, I see a lot of, where somebody has had a lot of dentistry done. They've had tooth by tooth things. They're older now. Teeth are starting to fail, and usually it's a molar. Well, he's been chewing for a while. Okay. Now some other things over here are having a problem. We're only going to be talking about the upper arch here. And now he's concerned about this area here. Why is he concerned here? It's basically because his primary chewing area for all these years has been compromised, and the patients intuitively know that when the chewing area is compromised on the opposite side, so here's the upper right, it's on the left side now he's having a problem, he comes in asking about how do I fix the upper right, when this has been like this for over 10-15 years. So why is he coming out? Because he's having trouble now chewing because the primary chewing area is compromised. So if you don't remember what I talked about where the primary chewing area is, let's take a look. Actually, before we do that, real quick, let's look at our risk assessment on this case. Like I said, it's pretty typical, but we're giving it an orange on sinus. We're going to give it an orange on bone density. We're going to give it a orange on ridge height and possibly a yellow on attached gingiva. So we're now kind of moving into this realm of what do we do with this distance here that kind of makes the implant a little top heavy in this position. So here's what it actually looks like up here. You can see how that bone actually kind of almost looks as dense as this tissue here. Now, when you're doing the surgery, you want to compress the bone. You want to, this is very, very soft bone, so that's why it gets an orange, but you do want to do a compression technique here. And really quickly, let's just look at why you have a CT. Is because you can do this simple measurement here and you can look at it. So he's got about 8.5 millimeters, but you're probably going to drop it more to a 7. So you will be into the sinus. I would recommend actually, let's just see here, I would probably recommend a 5, this is kind of hard to see on this one, a 5 by 10. Let's just look and see if we can find one. Here's a 5 by 10 here. Let's see what that looks like, just so we can just, this is the beauty of having CT, you can actually put a real implant in there. And so that's what kind of the 5 millimeter would look like if we were to do a 5 millimeter in this site. So that's not too bad. You could even do a 6 if you had a 6, but you've got a few millimeters that you got to deal with into the sinus up here. So that's not too bad. So what you're going to do here is either a hydraulic sinus lift, some sort of crestal approach. I don't do the hydraulics anymore, but I have little tools I got from Salvin that I just move the membrane up. The Hyoscine sinus tools I recommend. There's a good tools for sinus elevations all the way across. I just use allograft bone here, so I don't use anything in particularly special in this particular case. Some synthetics might be good here because some of those synthetic ones are more like bead-like and they spread a little bit more, which might, and also some of them can be osteogenic. So that's really what you want to be doing here. And maybe some of the graft can actually compress into the site. So this is a really good case for somebody wanting taking it to, let's say, a medium level of difficulty. You should have pretty straightforward success here. It shouldn't be too difficult to restore. And you're going to be looking at something, maybe a position something like this, where now you're going to have your molar here. The only question mark for me typically is the biomechanics on a case like this, where you are dealing with an implant here, but then you've got a very top-heavy crown. So that's where the oranges kind of make a little more sense. But overall, this is a great case. It's not going to get you into the twilight zone and get you into this weird place of being and you don't want to be. Take time with this case so that this will heal appropriately, and you won't have this kind of prematurely fail. So what else do I say about this case? I think that's pretty straightforward. And that was a little loud. Anyway, take care. Check us out on Facebook. Check us out on YouTube channel. Look for more of our case studies. There's going to be more coming up. Hopefully this was helpful to you. And we do some live broadcasts, so tune in for that too. All right, thanks a lot.